Hey there, future nurses. Let's dive into the fascinating world of pathophysiology and pharmacology. Pathophysiology is like figuring out what's broken. It looks at how diseases change our bodies, from cells to systems. Pharmacology is all about drugs, how they work, how they're given, and how they affect patients. As nurses, you'll be superheroes of healthcare. And understanding these subjects is your superpower. You'll use this knowledge every single day to assess patients, give meds safely, and provide top-notch care. Ready to learn? Let's go. Before we dive into the nitty-gritty, let's get familiar with some key terms. In pathophysiology, etiology is like detective work. It's about figuring out the cause of a disease. Pathogenesis is the story of how a disease develops from start to finish. Clinical manifestations are the signs and symptoms we see in patients, like a fever or a cough. Now let's talk pharmacology. Pharmacokinetics is how our bodies process drugs. Think absorption, distribution, metabolism, and excretion. Pharmacodynamics is all about how drugs work their magic on our bodies. And finally, adverse drug reactions are any unwanted or harmful effects a drug might have. Understanding these key terms will make learning about diseases and drugs way easier. Stay tuned. Ever stubbed your toe and watched it turn red and swell up? That's inflammation in action. It's your body's natural defense mechanism against injury or infection. Think of it like your body's alarm system. It's the first responder to any damage. When tissues get injured, our cells release chemical messengers like histamine and prostaglandins. These messengers cause blood vessels to widen and become leaky, allowing fluids and white blood cells to rush to the injured area. This influx of fluids causes swelling, which can be painful but serves a purpose. It dilutes toxins and brings in those superhero white blood cells to fight off any invaders and start the healing process. Understanding this process will help you assess your patient's injuries and wounds, anticipate their needs, and provide appropriate care. Section 4. Drug action, pharmacokinetics and pharmacodynamics. Now that we've covered inflammation, let's talk about how drugs work their magic in the body. Pharmacokinetics is like a drug's journey through the body. It involves 4 main processes: absorption, distribution, metabolism, and excretion. Absorption is how the drug gets into the bloodstream from where it's given, like your mouth, muscles, or veins. Distribution is where the drug travels in the body and how much reaches the target tissues. Metabolism is how the body breaks down the drug, usually in the liver, making it easier to eliminate. Excretion is how the body gets rid of the drug, mainly through urine or feces. Pharmacodynamics focuses on what the drug does once it reaches its target. Drugs interact with our bodies in various ways, often by binding to specific proteins called receptors. This binding can either activate or block the receptor, leading to a specific effect in the body. Understanding both pharmacokinetics and pharmacodynamics is crucial for nurses. Section 5. Nursing considerations. Safe and effective drug administration. Nurses must administer medications safely and effectively. Consider patient factors like age, organ function, and potential drug interactions. Infants and older adults process drugs differently. Always explain medications, dosages, and side effects to patients. Empower patients with knowledge for better adherence and recovery.